So, good afternoon, everyone. It's our privilege to extend a warm welcome to all of you for this insightful webinar series on experience of tobacco control law and policy. And today's focus is on Uttar Pradesh state. And today's sessions bring together our distinguished experts who has played a pivotal role in advancing tobacco control efforts and policy implementation in state of Uttar Pradesh. We are deeply honored and welcome our esteemed chief guest, Dr. Prakash Gupta, sir, Director, Healis-Sekhsaria Institute of Public Health, Mumbai, a global recognized authority in public health, epidemiology, and tobacco control, with remarkable career and spanning decades since 1966. Dr. Gupta has contributed extensively to the tobacco control research, authored several hundred publications. His contribution have acknowledged by prestigious honors such as Luther Terry Award in 2003 and Tobacco Free World Award 1999. And he has been recognized among the top 2% scientists worldwide by PLOS 2022. And welcome to the speaker of the day, Mr. Vivek Awasthi, Executive Director from Uttar Pradesh Voluntary Health Association. Was experience in community health policy advocacy, capacity building is significantly strengthened the healthcare system for vulnerable population. With over 20-year experience in the social sector, his leadership in impactful health enrollment program has made a lasting difference in public health. Welcome to Dr. Rakesh Gupta, sir, also, President and Director, Public Health, Strategic Institute for Public Health Education and Research, Sipher, Chandigarh. With the support of Dr. Rakesh only, we are able to organize this webinar series. And thanks to Dr. Sanchika Gupta from Eco India for their technical support, and Ms. Tamanna, the volunteer for Cipher, was contributing in success of this particular webinar series. We look forward for their insights, the experts' insight for during today's discussions, and welcome to all the participants who attend this webinar. Your presence make this session truly meaningful. So we are welcome to everyone. And now I will invite Dr. Rakesh Gupta, sir, to introduce our chief guest of the day.
Let me share the presentation again. I lost the presentation. So we have with us Dr. Prakash Chandra Gupta, Director of Healis-Sekhsaria Institute of Public Health, Navi Mumbai. So he could not be present physically, not physically, but on online also, as he had an important meeting. So he has sent his presentation. So we'll just listen to the opening remarks of him. Thank you.
I'm Dr. Prakash C. Gupta, Director, Healis-Sekhsaria Institute for Public Health. I'm very glad to see this webinar and its topic that is being organized by Sipher. Want to congratulate Dr. Rakesh Gupta on organizing the webinar on such an important topic. We all know that tobacco is the most important cause of adult death and disease in the world. So we all want to reduce the tobacco use. In addition to education and awareness, even more important are the policies for reducing tobacco use. India has reasonably good number and amount of policies for reducing tobacco use. So all depends upon how these policies are getting enforced. We know that some policies are getting enforced quite reasonably well and some policies are not getting enforced so well. I think this particular webinar will point out and tell us how to enforce all the policies very well in a strong way so that the tobacco use among population reduces considerably. So I look forward to the proceedings of this webinar, and I am sure everybody, all participants will benefit a great deal from the deliberations in this webinar. Thank you all very much for your attention.
So thanks, Dr. PC Gupta, for the video, I think. And over to Mr. Vivek Awasthi. So Mr. Vivek Awasthi, he is the Executive Director of the Uttar Pradesh Voluntary Association, Health Association. He is a public health leader with 20% years in the social sector, driving community health, policy advocacy, and program management in Uttar Pradesh. And he is master in sociology, and his expertise is public health, community development, policy advocacy, and capacity building. His role at UPVHA, he leads health programs, collaborates with stakeholders, and strengthens healthcare system. So let us listen to what he has to share, and he'll be sharing his experiences in UP with us. Thank you. Vivek, I've stopped sharing, and you can share your presentation, please.
Thank you so much, sir. I hope my slide is visible.
Yeah, these are visible. Yeah, make it slideshow.
Yes, sir. Yes, this is moving.
Yeah.
So thank you, sir. Good afternoon to everyone, respected chief guest of this webinar, Dr. P.H. Gupta, sir, respected Dr. Prakash Gupta, sir, from Sipher, Rajiv ji, RCTC, PGMER, Chandigarh, Strategic Initiative for Public Health, Eco India, Dr. Sanchita ji, Ms. Tamanna ji, esteemed participants, सभी को मेरा नमस्कार, डॉक्टर and Saju Sethi, sir. So thank you for inviting me in this very important webinar. And before I start, I would like to congratulate Sipher for the 6th anniversary. They are celebrating and doing very good job in tobacco control. So first of all, I am starting my presentation with the permission of share. The presentation will cover brief introduction of the state, existing legislation and policies, order, notifications, tobacco control, details of challan and other laws and provisions, strategy and mechanism adopted in the state and role of organization UPVHA in the state, other initiatives taken by STCC, DTCC and the NTCP, and challenges, recommendation and way forward. This will cover all the presentation. So before I start, I would like to quote here Dr. Rana Ajay Singh, sir. He said, what is tobacco control? How can we do the tobacco control? First, the answer, he said, the first is to help people quitting who are using tobacco products, and second, to stop initiating new people tobacco control. We know that today's chief guest was saying also, Dr. P.C. Gupta was saying that this is important to have a strong tobacco control policies, and same equally this is important to implement and enforce these policies, because if the policies are not implemented properly, we could not find the desired result in tobacco control. So just in brief of Uttar Pradesh, this is biggest state in the country in terms of population. More than 200 million people live here. Administrative, geographical and administrative coverage, this is divided in 75 districts, 18 divisions, 17 municipal corporations, 200 municipalities and more than 800 municipal panchayats. State has more than 58,000 gram panchayats. So first of all, however, we all know that what are the objectives and activities of National Tobacco Control Program. We have the National Tobacco Control Program covered entire nation, and in Uttar Pradesh, this is covering all 75 districts. The main objectives are to bring greater awareness. Sir, how much time I have actually? Because the presentation is too long.
You can go up to 1 if you want. Yeah.
45 minutes or 1 hour, na?
Yeah, half an hour more. Half an hour more.
Half an hour. Okay. Half an hour. Okay, sir. To bring greater awareness about the harmful effect of tobacco control, this is the one objective: reduce production and supply of tobacco products, to ensure effective implementation of the provisions of COTPA and other tobacco control laws, help people to quit tobacco use, facilitate implementation of strategies from tobacco control advocated by the WHO FCTC. And the activities are the same to support these objectives to achieve: monitoring tobacco control laws, training of stakeholders, information, education, communication, school programs, tobacco cessation. And apart from this, the states and all many districts are doing some other innovative activities, sharing their experiences, and this is going on. Actually, the role of organization is we are working as extended hands of state in state for STCC and DTCCs in advancing tobacco control, proper implementation of NTCP. Support in drafting, this support is in form of drafting, release, and implementation of tobacco control policies. Support in review of program at state and district level. Support in capacity building of officials, key departments, which includes mapping of officials and departments and stakeholders. Doing studies, sharing of findings, sharing of good practices, learning from you all, and drafting orders, letters, development, IC tools, kits. These are the activities we are doing in support of National Tobacco Control Program. With the
Vivekji, sorry to intervene. So we just want that how you enforce the law. What are the how do you form that task force, and who are the constituents of the task force, the enforcement agency? So please don't miss those. Yeah, thank you.
Yes, coming, sir. Support and development of okay, sir. So I am skipping these slides. Just a brief on the prevalence of tobacco in the state. There are 5.5% of tobacco users, all form of tobacco users. Comparison to the national data, this is high, quite high. In national data is 28.6%. Smokers are 13%. Smokeless tobacco users are quite high, 29.4% in the state. I am not going to in details of this data. This is the overall structure of NTCP in the state. We have a state consultant, state nodal officers, DEO. In districts, we have district consultants, psychologists, social worker, data entry officers. We have the policies actually for implementation of and enforcement. We have COTPA, Juvenile Justice Act, Provision of Electronic Cigarette Act, Uttar Pradesh Municipal Corporation Act, the Food Safety and Standard Act, Labor Act, CRPC, Bharatiya Nyaya Sanhita, we have. So other policies we can tell about WHO Framework Convention. We all know this is the theme. The WHO Empower National Tobacco Control Program, state policy on Article 5.3. The state has tobacco-free education institution guideline from Ministry, ban on hookah bar, advisory from Ministry of Health, Family Welfare. We have Environmental Protection Act. These are the policies and acts we have to implement. Okay. So, talking about the strategy, what we are, Dr. Rakesh Gupta sir saying, we want to hear that strategy. Generally, this is the global uniform strategy we are all adopting in implementation of any program, including tobacco control program. First, we develop the institutional framework, state tobacco control cell, district tobacco control cell, state tobacco control, state level committee for district level coordination committee, state level coordination committee, then enforcement squads, is most enforcement plan, nomination of nodal officer within the nodal department and outside the nodal department, key departments which are uh, police, police education, these are urban development, panchayati raj, then agriculture, then road transport, then tourism. So these are many important departments, and this is important to have the nodal officers, key persons for responding on the tobacco control issues and reporting purpose. Second is strategy to advocacy and support for notification of supportive orders from higher level, strengthen existing laws if there are any loopholes at local level, review meetings, follow-up letters, all the state tobacco control cell and the policy makers, leaders are taking care of these things. Emphasis on enforcement of legislation through capacity building. This is important because the people who are responsible to enforce these policies and orders and laws in the state, it's important they are knowing that what are the policies and how to enforce, what is the mechanism of enforcement and how to report. Open to innovative ideas, adaptation, studies, findings, sharings, and implementation, and for replications. So monitoring and documentation is very important. So at the state level, district level, timely review of the program and activities and finding the gaps and then planning and execution. These are the strategies we are adopting, state tobacco control cell is adopting and doing this. If talking about the policy orders and notifications, there are a number of state level orders. Here I am sharing some of them. We have ban on cover order, ban use of tobacco products in public places, all tobacco products, state possible tobacco bundle licensing is there. Ban on sale of loose cigarette order is there. The state level order, state policy on Article 5.3 to stop tobacco industry interference is there. Enforcement of provision of e-cigarette, that is the national level, and state level also order is there. State level order for not to partner with tobacco companies, ban on sale of twin package, smoke-free polling booths, tobacco-free village manual, creation of tobacco-free institutions, tobacco-free Mela enforcement, and tobacco-free divisional orders and all kind of. So these orders are there. These are some copies. These are the top level leadership orders from Chief Secretary Uttar Pradesh to all the officials, from DGP, from Chief Secretary again regarding the hookah bar ban, and then the implementation of Juvenile Justice Act, Section 77 by Upper Mukh Sachiv, Additional Chief Secretary. Ban on loose cigarette, and then comprehensive orders on enforcement of laws, monthly reporting, inclusion of code point policy syllabus, sensitization of CSOs, and this is the 4-page comprehensive order. Other activities to strengthen the legislation enforcement of existing laws, tobacco laws, capacity building and sensitization of law enforcement officials, yellow line campaign, model creation like tobacco vendor licensing, tobacco free village, declaration of COTPA compliant jurisdictions, otherwise the offices, otherwise the premises. Sharing about the recent development in enforcement in the state. This is section wise of COTPA, number of person fined 790. This is for 23-24 financial year. Then number of persons section 5, 61, 6A, 846, Section 6B, 991, and the number of person challan 63 in Section 7. And for 24-25, this is detail of the challan enforcement made, number of person 53666 in Section 4, Section 557, Section 68375, 6B 296, and Section 7 165. So other than the PECA implementation is there, and we know the GB Nagar in Fatehpur district, the siege and search was done by the police officers, and a lot of electronic cigarettes were seized, FIR was made, and people behind this were detained. These are some pictures from different areas of in the state for the enforcement by the squad. Actually, mainly the enforcement is made by the squads notified by district administration, and second, some departments are doing internal enforcement and they are reporting to respective district tobacco control cells. And so these are some pictures of this enforcement activities. And one thing I would like to share here is that the enforcement is not only for the better implementation of the existing policies, but this is also the very good tool for greater awareness in public about the harmful effect and about the implementation of program and compliance of these activities. So media coverage of enforcement activities, actually GST department intelligence is also doing the very excellent job in Uttar Pradesh. They are continuously doing siege and search, and all the जितना भी टैक्स चोरी हो रहा है वो उस पर नजर रखे हुए हैं लगातार, और वो मीडिया में आता ही रहता है. ये second thing is very important. We are doing implementing the program, the capacity building and sensitization of stakeholders, and particular state cell and district cell are doing the sensitization, capacity building, departmental wise they are also doing. So these are the for law enforcers particular focused on. This is the state level for all the districts and working on NTCP program, sensitization of Panchayati Raj officials, sensitization of urban local bodies on tobacco vendor licensing, capacity building of education department principals, school principals on toffee implementation, sensitization of road safety. So these are the initiatives mainly taking. The other initiatives are the launch of yes, we know that Ministry of Health Family Welfare was launching the Tobacco Free Youth Campaign 2.0, and the state has also the Honorable Deputy CM, and he is the Minister of Health also, Cabinet Minister, launched the guidelines issued by Ministry of Health and Family Welfare, the toffee guidelines, tobacco free village guidelines were used, and the effect was very good. After that, the second initiative was that with the support of vital strategies, and before the union, we conducted some studies, and the findings were shared at state level meetings and with relevant stakeholders. And after that, the enforcement on GST and tax evasion was increased very much. So this is also the matter of study, that how much difference has been come. So this is also a study on environmental burden of tobacco products and was released at a state level. And the effect was that some of the factories, companies operating in Uttar Pradesh are shifting to other states due to the high surveillance and enforcement of GST and all those things. So one other initiative we are doing in implementation of the policy 5.3 in state. These are district level committees, and they are monitoring at district level, local level, that if there is any interference or tactics of tobacco industry. So the boards were also developed by state tobacco control cell and been displayed at key departments. Tobacco vendor licensing is also a very strong and important tool in implementation of the policy. Through this particular policy, we can implement Section 6A, 6B, Section 5, Section 7, all those toffee, all those are very easy to implement. And in Uttar Pradesh, Commissioner Lucknow is taking lead, and the municipal corporation is supporting in implementation of toffee in Lucknow, particular municipal corporation. So they have done a wonderful job, the Yellow Line campaign and removing the tobacco vendors in the premises radius of 100 yards, and more than 2,000 educational institutions being declared tobacco free this time. These are the release of vendor licensing we are doing. One another good initiative, I think the State Tobacco Control Cell is taking lead, and we are supporting that. The one model development of tobacco free village was done in Gram Panchayat Nagli Kithor, in line with the implementation of tobacco free village initiative of Ministry of Health and Family Welfare, Government of India. And several activities being done and being captured, recorded for replication. And after that, this is actually a separate presentation of 30 minutes, but I am sharing only specific things. So declaration was issued, and the DM Saab and Member of Parliament and CDO and district level officials presented certificate to Sarpanch of that particular village, Gram Panchayat. And on the occasion, a big event was organized for dissemination and recognition, and the good media coverage was also there. We are sharing actually this presentation in state level meetings also, and in particular with the PRIs also to sensitize them and to motivate them for taking actions. One initiative is the sensitization and orientation of judicial officials being done in Lucknow. 65 junior judges were oriented on tobacco control laws. This is the procedure, sir, you are asking about that. Usually in Uttar Pradesh, in DLCC, after DLCC meetings, when district magistrate instructed district team to develop a plan, this kind of plans being developed in several districts, enforcement plan where the officials nominated and the teams were formed, then उनका प्लान कि कब किस क्षेत्र में किस जोन में who will be going. Yesterday I was in meeting in DLCC meeting in Lucknow, so the chairperson instructed to develop again new 16 enforcement squads. So 8 for zones, municipal zones, and 8 for all 8 blocks. So 16 new, and he is asking for to form and to notify. So this kind of and in many districts they are also nominating members of UPVHA for coordination, not for enforcement, but coordination with all these squads and officials. So these are the orders on ban on loose cigarette and UP and this kind of thing. This new good initiative in Uttar Pradesh, we know all that UP got WHO WNTD award in 2021, and the Yellow Line campaign was is strongly supported by state government, and not even in education institution 100 years. Mainly, I would say that I would like to share that the officials, government officials, you can see the Jila Basis Chadikari, Hamirpur, they are making this kind of doing this kind of activities and making their offices tobacco free. So this is very good initiative. This is Lucknow University. The vice chancellor is there, and all the dean and senior officials and students, NSS. This is AIMS Raebareli. We can see the Panchayat pictures, Yellow Line campaign is there, tobacco free. And the second is the after enforcement and study findings being shared with district administration. 14 high compliant districts being identified and reports were shared, and out of them, this 10 has been declared smoke-free, tobacco-free by respective district administration till date. So these are some examples of Yellow Line campaign. I will share the video also. We developed with the government actually developed, we supported. And these are some declarations made after high compliance of COTPA in districts, and certificates were issued. So coming to the challenges, actually, the big state, this is a challenge. Tobacco industry tactics and interference is the greatest challenge, I would like to say here, in tobacco control. So they are doing many things, lot of things to derail the implementation of National Tobacco Control Program, policies, enforcement, all those things. Sometimes frequent transfer of officials hampered the ongoing good running enforcement and implementation. Way forward, state order on removal of DSA, DSR, the state is pushing. We are supporting state policy on total ban on surrogate advertisement. We achieved something here. The order was passed 2 months back by the divisional commissioner, by the Nagar Nigam. Implementation, we are pushing. There is little hesitation, but yes, we are sure we will be doing a good job. State policy on tobacco-free generation, we are pushing that. State policy of age, so that it's through COTPA amendment. And through COTPA amendment, hookah bar ban is very important for us now, because tobacco industry is doing something to regulate the hookah bar in the state. So tobacco-free Kumbh Mela is another initiative. So our recommendation from my side is the constitution of committees, all levels, yes, we know, and regular review of activities and progress under the program is very important. Line listing of key departments and nomination of notification of nodal officers in departments, capacity building of officials, enforcement officials, development of intersectoral interdepartmental coordination, including the identification of and line listing of these officials and departments. Challan books, provide the challan book received to all departments, notification of rating squads, and implement of enforcement plan and education. A declaration tobacco-free, smoke-free public places and jurisdictions, and their dissemination, recognition, and replication is very important. And if the time allows, I don't know, sir, I can play here the one video I have.
How long it is?
This is 5 minutes, sir.
Okay. Show it.
Is the Sound is there, sir?
No, we can't hear.
Sir, just a minute.
Huh.
Is there?
Yeah, but it is cracking actually.
Yes, sir.
का हर वर्ग में बढ़ता हुआ उपयोग एक जन स्वास्थ्य समस्या बन गया है। भारत में प्रतिवर्ष करीब 10 लाख लोग तंबाकू के उपयोग के कारण असमय मृत्यु का शिकार हो जाते हैं, जिन्हें समय रहते बचाया जा सकता है। आज के परिदृश्य में तंबाकू एक ऐसी समस्या है जिस पर चौतरफा दृष्टिकोण के साथ कार्य करने से ही सकारात्मक नतीजे प्राप्त हो सकते हैं। धूम्रपान करने वाले व्यक्ति पर जितना गंभीर प्रभाव पड़ता है, उतना ही प्रभाव उसके आसपास के रहने वाले लोगों पर पड़ता है, जिसमें बच्चे एवं महिलाएं शामिल हैं। तंबाकू के उपयोग के कारण कई घातक बीमारियां होती हैं, जिसमें हृदय रोग, श्वसन रोग तथा कैंसर प्रमुखता से करते हैं। भारत सरकार द्वारा निम्न लक्ष्यों, उद्देश्यों, रणनीति के अनुसार प्रदेश में तंबाकू नियंत्रण कार्यक्रम एवं पोटपार 2003 का संचालन किया जा रहा है। राष्ट्रीय तंबाकू नियंत्रण कार्यक्रम एवं पोटपार 2003 का लक्ष्य प्रदेश की सामान्य जनता, विशेषकर युवा पीढ़ी को तंबाकू से होने वाली हानियों के प्रति जागरूक करना, प्रदेश में पोटपार 2003 का प्रभावी क्रियान्वयन एवं अनुपालन करना, तंबाकू सेवन करने वालों को तंबाकू छोड़ने के लिए प्रेरित करना है। सभी चीजों को देखते हुए सरकार ने तंबाकू मुक्त करने के लिए कई कार्यक्रम चलाए, जिसमें हम जनता को जागरूक करेंगे, अधिकारियों को भी निर्देश दिए ताकि वो प्रोग्राम चलाने में प्रशासनिक सहायता प्रदान कर सके, ताकि ये प्रोग्राम सुचारू रूप से सभी जिलों में चलाया जाए। राष्ट्रीय तंबाकू नियंत्रण कार्यक्रम के अंतर्गत पोटपार 2003 का उक्त लक्ष्य को ध्यान में रखकर प्रदेश में प्रभावी अनुपालन कराया जा रहा है, जिसके क्रम में दिनांक 2 अक्टूबर 2018 को महात्मा गांधी की 150वीं जयंती पर महानिदेशालय प्रांगण में झंडारोहण के पश्चात तंबाकू निषेध शपथ दिलाते हुए समस्त उत्तर प्रदेश में तंबाकू से आजादी कार्यक्रम के अंतर्गत येलो लाइन कैंपेन का शुभारंभ हुआ। इस येलो लाइन कैंपेन को विश्व स्वास्थ्य संगठन ने अपने आधिकारिक वेबसाइट पर सराहा है। इस वर्ष हम सरकारी कार्यालय संस्थानों कैंपेन के अंतर्गत जाएंगे और वहाँ
Vivek ji, can you improve the sound? There's problem. साउंड में कुछ दिक्कत आ रही है।
अच्छा।
दुकान नाम इस इनोवेटिव कैंपेन के तहत सरकार का उद्देश्य
Now it's better.
सारी सरकारी
हाँ ठीक है।
जनपद स्तर जिला उन्मूलन के 87,826 व्यक्तियों को काउंसलिंग प्रदान की जाए। जनपद रामपुर एवं अयोध्या को तंबाकू मुक्त जनपद घोषित किया जा चुका है। अन्य 25 जनपद भी किसी और अग्रसर अभियान में 150 प्रतिशत जनपद शैक्षणिक संस्थान तंबाकू मुक्त परिसर तथा इन प्रयासों से प्रदेश में तंबाकू का उपयोग कम, जिससे कि प्रदेश की जनता का स्वास्थ्य बेहतर हो सके।
Thank you, Vivek ji. So you can stop sharing this. Yeah. So thank you, Vivek ji, for your excellent presentation. And it is very heartening to note that government of Uttar Pradesh has made this video, which it actually encompasses all the activities undertaken by you along with the state tobacco control cell, the state the state coordination committee also, state level coordination committee also. So we'll just, before just asking you questions, can we ask all the participants to open up their videos so that we can have a snapshot, please? Thank you. Please open up your videos for a snapshot. And after that, we'll ask questions. Yeah, please open up your videos, Ramesh. Yeah, thank you. So we have close to 60 participants with us. So Rameshji, Vivekji, will just like to know that how you implement the ban on hookah bars. Can you share with us?
Yes, sir. This is very important and burning question for us in Uttar
Yeah.
Pradesh these days. Actually, what
नहीं,
happens,
जैसे
sir?
आप रेड करते हो तो आप एनफोर्समेंट एजेंसी सारी होती है, उसमें पुलिस ऑफिशियल्स होते हैं हमेशा?
Yes, sir. I am sharing, sir.
Okay.
Actually, what happened, sir, in 2020 when the COVID epidemic was there, then the was one PIL was sent to High Court, submitted to High Court. So before that, the Uttar Pradesh government has already notification to ban hookah bar and this kind of thing. But High Court then issued directives to government of Uttar Pradesh to take action. And then after 2 days only, Chief Secretary has banned the hookah bar till the next order. In just February 2023, one PIL was submitted to High Court, and they were asking to review and to open. This is the business, and then High Court ordered FDA department to issue the license, if consider issuing a license. But the problem was FDA is nowhere interested, and they asked FSSAI what to do in this matter. FSSAI said that we can't, because the hookah bar is not a business, not registered as a business in our website, nor it is a khadya padarth, food item. So we can't give license or regulate this.
नहीं,
So,
आप ना हमें बताइए कि जैसे अब हुक्का बार की कोई कंप्लेन आई है आपको, ठीक है, तो उसके बाद क्या एक्शन होता है आपकी तरफ से, बस वो बताइए.
yes, sir. Directives are there, sir, and actually the police department is booking these hookah bar issues under the भारतीय न्याय संहिता 271 की जो फैलाना है 151, वो सारे में चालान कर रहे हैं, सर.
अच्छा.
भारतीय न्याय संहिता में जो आप एक न्यूसेंस क्रिएट कर रहे हैं उसका वो धारा लगा दे रहे हैं, तो 271 लगा दे रहे हैं, 272 लगा दे रहे हैं कि आप जो है ये इस तरीके के जो हेल्थ इश्यूज हैं, हजर्ड हैं, वो फैलाने में प्रयास कर रहे हैं. वो कर देते हैं, बट सर वो एक ठोस कोई
नहीं, आपके पास वो कोई वो कॉर्पा अमेंडमेंट नहीं हुई है इसमें हुक्का बार के लिए?
कोर्पा अमेंडमेंट के लिए सर हम लोग प्रयास कर रहे हैं. वी आर
अच्छा.
सबमिटिंग ऑल द सपोर्टिव डॉक्यूमेंट्स टू FDA, और वो एक्चुअली PIL केस अभी चल रहा है कोर्ट में. उन्होंने कहा है कि हम नहीं कर सकते, और ऑलरेडी 14 स्टेट्स हैव बैंड होका बार. सो वी आर वेरी होपफुल दैट डिसीजन विल कम, बट उसका ग्राउंड जो है वो बना के हम लोग कर दे रहे हैं. तो अभी आज भी कल भी मतलब 1 डे बैक कमिश्नर से भी मिले थे हम लोग. कमिश्नर ने भी सारा डिटेल मांगा है. आज फिर 4:30 बजे बुलाया है डिस्कशन करने के लिए. वो सारा देख के आया था मैं कि व्हाट इज क्या क्या हो सकता है, एंड FDA को भी, तो बोथ को हमने दिया है. गुजरात से भी मैंने मांगा, कर्नाटका से भी मांगा, जितने भी बैन ऑर्डर्स हुए हैं उनका सारा.
चलो विवेक जी, मैं ना आपके साथ अपने एक पावर पॉइंट शेयर करूंगा रिगार्डिंग हुक्का बार्स. आई थिंक दैट विल बी हेल्पफुल.
बिल्कुल बिल्कुल सर, आज ही करिए, मुझे तो आना है, प्लीज. करेंगे
ठीक
तो
है. और इम्प्लीमेंटेशन ऑफ पीका के बारे में क्या कर रहे हैं आप?
पेका में भी सर जो भी है ना, अभी मैंने आपको शेयर किया था वो जो केसेस हुए हैं, तो पेका में एक हमारे यहाँ, एक तो नोएडा में हुए 2-3 केस, उसमें लोगों को डिटेन किया उन्होंने। और दूसरा उसमें उन्होंने, मैंने जो बेंगलुरु में आई 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 हैव शेयर्ड दैट, वो जो है नारकोटिक्स एक्ट लगा दे रहे हैं।
Narcotic X. So
या
that is
वो
excellent.
वो लगा दे
Okay.
रहे हैं, हाँ वो लगा दे रहे हैं, उसमें उसमें बंद कर दे रहे हैं। एंड
Okay,
देन
that's good.
इन फतेहपुर प्रॉपर जो उसका गाइडलाइन है पेका का, उसमें उनका वीडियोग्राफी करके पूरा, एक सिगरेट ही हालांकि इलेक्ट्रॉनिक मिला। देयर व्हाट द डिस्ट्रिक्ट कलेक्टर वाज वेरी, वो बहुत ज्यादा उस पे उत्सुक थी। उनको ले जाके क्या हुआ कि जब रिपोर्ट हुआ सर, हमारे यहाँ से ही यूपी बीचे का स्टाफ ने किया,
Hmm.
उन्होंने, वो भाग गया दुकानदार जो बेचता था, तो उन्होंने वहां पर सीसीटीवी कैमरा लगवा दिया।
Okay.
24 घंटे सीसीटीवी कैमरा लगा रहा,
Mm-hmm.
कि ऐसा ना हो कि सामान गायब करे। तो फिर
Mm-hmm.
किसी तरीके से आया, उनको किया गया, रीच किया एटीएम, और सारा पूरा जो एडमिनिस्ट्रेशन था वो लगा रहा, आया
नहीं
वहां
अभी
पर।
तक ना till now how many cases they have been booked under PICA 2019
अभी पेका के
by
सर,
police department?
हाँ, पेका के सर डायरेक्ट जो है वो 4 में एफआईआर हुआ है।
Okay,
तीन
that
तीन
is
वहाँ
quite
है
good.
और एक, हाँ, एफआईआर हुआ है, केस डिटेन कर लिए गए हैं उनको।
So you have been doing capacity building workshops for police personnel regarding.
हाँ सर, बहुत ज्यादा कर रहे हैं, वी आर डूइंग रेगुलर रेगुलर बेसिस पे, हर डिस्ट्रिक्ट में हो रही है रेगुलर बेसिस में। अभी आई थिंक 10-12 डेज पहले लखनऊ में हुआ, उससे पहले बाराबंकी गया था मैं, स्टेट कंसल्टेंट, तो सारे लोग तो कंटिन्यूस वी आर डूइंग दैट। एंड वो जो डिस्ट्रिक्ट टीम्स है वो लगातार कर रही
So Vivekji, I'll be asking all the people who have attended, participants. This is an open discussion, so they'll be asking you questions. So it is good that you are involving academic institutes and seeking and quoting studies regarding the issue of the tobacco, and uh, and you also shared with us the policy orders and notifications that were excellent, and the media coverage of enforcement is really excellent. And I may suggest that you may involve legal metrology act if you are not involving the legal metrology inspectors. So make them a part of the enforcement teams. So I think that is important.
है। यस सर।
And toffee guidelines, the tobacco-free villages, you are implementing very nicely. So thanks a lot. And the house is open for discussions. But first, I'll ask Mr. Ramesh Gandhi to give his concluding remarks on the presentation, please. Yes, Mr. Ramesh Gandhi, Dr. Ramesh Gandhi, are you available? Jail Thomas,
Yes, sir. Yes, sir.
yeah, Jail,
I'm there.
yeah.
Yeah. Thank you, Vivek ji. It's a nice presentation, and I know it's a huge state, more than 75 districts in UP. Can I ask questions, sir?
Sure. You can
Okay.
ask.
Yeah. So I have 3 to 4 questions. One, I have seen that in UP, smokeless tobacco is more. So I just want to know, आपने बैन ऑन लूज सिगरेट का किया था एंड ट्विन पैक का एनफोर्समेंट किया था। आई जस्ट वांट सम इंफॉर्मेशन, ये ट्विन पैक के ऊपर आपने कैसे केसेस रजिस्टर हुआ है एंड हाउ मेनी केसेस रजिस्टर किए हैं आज तक यूपी में। दैट इज वन क्वेश्चन बिकॉज वी आर फेसिंग सेम प्रॉब्लम इन कर्नाटका for booking cases in twin package. And second, as per your presentation, you have mentioned like in less districts, very less, I think, few districts they have not constituted DLCC committee. मेरा ये क्वेश्चन था कि in all the 75 districts, is there any squad formed for enforcement of Section 4? If yes, why the number of cases is very less?
respond now.
Yes, yes.
Thank you, Jill, for your questions. One is regarding the ban on loose cigarette. That was order was issued in 2017 by Principal Secretary Health. and the basic was on the section 7, because the pictorial warning is not there. So they banned selling of loose cigarette, and a lot of enforcement was done since that time. But the seizure was not there in case of the loose cigarette. Seizure was there in seizure was done in illicit trade, on illicit trade. But in case of loose cigarette, the enforcement teams were booking them under the any other section, section 4, 6A, 6B, but warning them to not sell. So sometimes I have seen that the point of sale tobacco sellers have displayed the one liner that we are now selling loose cigarette here that time. Second, I am not aware actually the enforcement of twin pack in Uttar Pradesh. What happened? I will check because I don't know where the enforcement was done and what was the base for that enforcement. So I am not aware about that. And third, why the chalaning is very low? Yes, this is good question. In Karnataka, I know there is a huge challan made on section 4 and all the code sections and tobacco control laws. In Uttar Pradesh, actually, there are some other challenges, minor challenges, major challenges. One is that in 75 districts, there is only 20, the staff is only in 26 districts. We are also supporting there, covering a lot of districts. Yes, DLCC is there constituted. They are reviewing. Sometimes they are reviewing in DHS meeting. In practical, this is in theoretical, this is good. You can cover the tobacco control also, but in practical, I think this is not very productive if you are not discussing. So sometimes this happened in absence of the proper staff. So the state is taking decision and they are doing to deploy the full-fledged team in the state. That's why the chalaning, and second is also the matter of reporting, and some departments are doing the chalaning and they are not reporting, or police department is also not properly reporting. So that is also one case. Yes, the squads are there in most of the districts, not for only section 4, for 6A, 6B, section 4, section 5, because this is in the guidelines, and the capacity buildings has been done, and the someone from the mental health or NCD department, they are coming here and they were told that you have to constitute and you have to develop this kind of mechanism. And the second thing is that because of the MIS, people are supporting them and they are asking if the reports are not coming, they are asking why reports are not coming. Whether they are reporting 0 and then first they are starting reporting, then they are emphasizing to report something, what happening. So this is in towards the progress, and state is achieving one by one something. But yes, this is a little low enforcement. In the tobacco-free youth campaign, this was accelerated, and now this is going on up and up. Thank you.
Yeah, thank you, Vivek ji. I think आपने clearly rightly said कि monitoring है. I think that's the main issue, because from other department reporting अगर नहीं आता है तो numbers will be very less. I think you can focus on that one. So thank you so much.
Well, thank you, Vivek ji. Mr. Sani, do you have any questions for Vivek ji?
Good afternoon, sir. Good afternoon to all.
हाँ जी, नमस्कार
सर, मेरा डॉक्टर अवस्थी सर से एक छोटे सी क्वेरी है सर. सर, जैसा मैं फील करता हूँ, मैं उसी कंटेक्स्ट में पूछ रहा हूँ सर, कि हम 6B में जब चालान करते हैं, स्कूल के 100 यार्ड्स में अगर कोई टोबैको सेलर मिलता है, तो सिंपली सर कई साइकिल वाले कोई रिक्शा वाले होते हैं, उनको 200 रुपया दे करके चले जाते हैं, आधा घंटे बाद फिर वापस आ जाते हैं। तो क्या सर उत्तर प्रदेश में ऐसा कुछ हुआ है क्या कि उनको खिलाफ 200 रुपए के अलावा भी कुछ और जुर्माने या कुछ कुछ पेनल्टीज या उनको पाबंद करने के लिए कुछ इस तरह की कोई कार्रवाई, ताकि हम भी हमारे यहाँ शुरू कर सकें सर उसको थोड़ा?
ठीक है सर, थैंक यू फॉर योर क्वेश्चन केसी सैनी साहब। एक्चुअली सही कहा आपने कि कई बार क्या होता है कि दुकानदारों के ऊपर चालान होता है। जैसे कि लखनऊ की बात करूं तो अभी म्यूनिसिपल कॉर्पोरेशन ने जिम्मेदारी उठाई, जोनल वाइज उनका कैपेसिटी बिल्डिंग का दुकानें हटाई। कई लोग नहीं हटाते, चालान हो जाता है, ठीक है हटा लेंगे वापस जाके, क्योंकि ये ओवर बर्डन रहते हैं, चाहे पुलिस डिपार्टमेंट हो, इन्फोर्समेंट में, या आपका कोई भी डिपार्टमेंट हो। तो ये इशू आता है। जो आपने पूछा कि क्या ऐसा कुछ हुआ है कि आइदर दिन 6B और भी कोई किसी में चालान बुक हुआ? यस, हमारे यहाँ उन्नाव में केस हुआ था, वो उसको जुवेनाइल जस्टिस एक्ट में बुक किया था। आप जानते हैं कि वो गंभीर धारा है, वो नॉन बेलेबल है। काफी दिन हमने उसमें फॉलो भी किया, अधिकारियों का एक्शन हो रहा है। शुरुआत में तो ठीक है, जब वो रिपोर्ट हुआ, मैं ग्राउंड लेवल की बात बता, रिपोर्ट हुआ और शुरुआत में जब ये सारा, तो काफी एग्रेसिव तरीके से चीजें हुई। उसके बाद फिर धीरे धीरे लगता है कि शायद उनको लगा कि अरे कोई निरीह प्राणी बहुत हार्ड, उसके ऊपर हार्ड कोर लग जाएगा, तो उसको धीरे धीरे थोड़ा सा नेग्लिजेंस की तरफ जाने लगे। लेकिन वो काफी उसका प्रचार प्रसार हुआ था उस मैटर का। और अभी बाल संरक्षण जो आपका आयोग है, उनकी तरफ से जो ऊपर से प्रेशर हुआ, कहा गया, हमारे यहाँ एसीएस साहब थे होम, उन्होंने लिखा सबको कि आप जुवेनाइल जस्टिस एक्ट में करिए, और वी आर प्रेजेंटिंग जुवेनाइल जस्टिस एक्ट सेक्शन 77 इन ऑल द आवर प्रेजेंटेशंस। मगर मेरा पर्सनल अगर कहें, मेरा जो फील है वो ये है कि जुवेनाइल जस्टिस एक्ट में इन्फोर्समेंट या किसी को बुक करने में थोड़ा सा हेजिटेशन रहता है इन्फोर्समेंट ऑफिसर्स के ऊपर, क्योंकि वो समझते हैं कि 200 रुपए का जुर्माना करें। कई बार क्या होता है कि वो भी देने में काफी दिक्कतें होने लगती हैं, लोग पैर पकड़ने लगते हैं जिनके पास प्रॉब्लम है या कुछ ऐसा। तो उनको पूरी तरीके से बंद कर देना जो कर रहे हैं, तो उनको थोड़ा थोड़ा सा एजिटेशन मैंने फील किया है कि लगता है कि मैं कई बार कहता हूँ, पुश करता हूँ कि आप इसमें बुक कर दो, उसको मॉडल, उसको एक नजीर बनाओ लोग उससे, ताकि बच्चों को शुरुआत कराने से। लेकिन थोड़ा मैंने फील किया है। बाकी यह है कि रोज जुर्माना किया जा सकता है, दिन भर में कितनी बार जुर्माना किया जा सकता है, दिस दिस डिपेंड्स ऑन द इन्फोर्समेंट ऑफिसर्स डिसीजन। उनके अपने विवेक के ऊपर है कि वो एक जगह अगर दोस्त लगाए हुए हैं बच्चों को, तो किसी भी तरीके से अलाउ तो नहीं करना चाहिए कि वो वहां से हटाएं। 200 रुपये का जुर्माना करेंगे, 77 जे एक्ट लगाए, ये उनके विवेक के ऊपर है। अब उसको ज्यादा अगर हम लोग पुश करना शुरू करेंगे तो निश्चित रूप से बढ़ेगा, हम लोग अभी कर भी रहे हैं।
हाँ विवेक जी, ये जो जुवेनाइल जस्टिस एक्ट है ना, दैट इज वेरी इफेक्टिव एक्चुअली।
जी सर जी।
And even if one challan is, I mean, court challan is done in a district, so that will, I mean, check the violators for many months or maybe even a year. It is very effective, and the fine is very stringent, about 1 lakh rupees,
हाँ बिल्कुल एग्रीड सर,
and they
बिल्कुल।
can be imprisonment up to they can be imprisoned for up to 7 years. So we have Dr. Dilip Acharya with us.
सर वन मोर क्वेश्चन सर।
हाँ sure.
सर देखिए, जे एक्ट में कार्रवाई करना अच्छी बात है सर, लेकिन बड़ा मुश्किल होता है जिलों में छोटी जगह पे इस्तेमाल करना। लेकिन इसका सर मैं आप सबसे एक रिक्वेस्ट करूंगा कि हर राज्य से, हर स्टेट से एक रिकमेंडेशन भारत सरकार को जाए कि टीवीएल को शुरू किया जाए भारत सरकार के वहां से, टोबैको वेंडर्स लाइसेंसिंग। अगर टीवीएल जिस दिन शुरू हो गया, 6 भी अपना आप कंट्रोल में आ जाएगा सर। तो ये मेरा आप सबसे आग्रह है। मैंने सर कई बार माननीय प्रधानमंत्री जी मोदी के वॉल पे लिखा है, एक्स पे भी लिखा है कि सर भारत सरकार की तरफ से इस तरह कुछ इनिशिएटिव ले और इसको टीवीएल को पूरे देश में एक साथ शुरुआत करी जाए। उससे बहुत सारे जो कोर्टपा के कंप्लेंट्स है वैसे हो जाएंगे सर, वायलेशंस बंद। ये मेरा कहना है।
So I agree, Sunny Saab. So tobacco vendors licensing is very effective tool with us, and if we have provision in the municipal act, it is excellent, and we must implement it very nicely. So
जी
now we have Dr. Dilip Acharya with us. So Dr. Dilip Acharya, any comments on the presentation, please?
Sir, good morning, everybody.
Yeah, thank you.
Sorry I joined a bit late.
Uh-huh.
Yeah. My only thing is कि जब जुवेनाइल जस्टिस एक्ट आया था तब तो we had given it a quite publicity and काफी न्यूज़पेपर ने कवर भी किया था उसको. But as is rightly been pointed out, इसमें कोई भी केस बुक नहीं हो पा रहे हैं अभी तो. तो we have to keep on at least पब्लिसाइज भी होता रहता है ना जुवेनाइल जस्टिस एक्ट के नाम से किसी भी कारण से. Maybe we just when the day it was this thing came on print, we can say साल भर हो गया, 2 साल हो गया इसमें नहीं आया करके, and he publicized that act, the salient features concerned with tobacco. तो लोगों को definitely फर्क याद रहेगा, मालूम रहेगा.
Yeah, yeah.
जहाँ तक वेंडर लाइसेंसिंग का है, मध्य प्रदेश also we have this issued passed by the government of Madhya Pradesh, but ultimately it is the Nagar Palika or the local municipal corporation which has to implement this. And when I did talk to the local Mahapur also, the mayor of Indore, he said, no, sir, it is very difficult. We cannot get it done. So it is not the political will that is the most important here. The administrators and politicians, these two
Yeah, yeah.
people, if they are convinced that it should be done, then it will be done. Otherwise, so we will keep on running from pillar to post, and nothing will be happening.
Yeah, yeah.
Yeah, that's my pointers. Thank you.
Yeah, thank you. Thank you, Dr. Dilip. So these are the very valid points, because political will is must for implementation of all kinds of law, in fact, not only COTPA, but
Very
all
much.
kinds of law. Yeah, thank you. So any participant who has any question for Mr. Vivek, they're welcome. They can unmute and
Yes,
just ask themselves.
yes, sir. Myself, Pramod Kumar, sir, from Sambandh Health Foundation, sir.
Okay.
It's excellent presentation from Vivek Awasthi, sir, from Uttar Pradesh. Actually, currently we are working in Meghalaya and Andhra Pradesh with the police department.
Yeah.
Since started, sir told that the police department is working very nicely and controlling Mahakumbh Mela is very effectively they are doing. So my request, my suggestion that if police is efficient to do more work in all 75 districts, can we not start the work, this GOTPA implementation through the police department? At the same time, there's so much required for the different all the districts, but as per our experience, sir, we are currently 100% district activation with the police department. So can we start the implementation through police in Uttar Pradesh? One question.
Yeah.
Second question, sir. Actually, sir has presented all the things, but there is a missing of loose cigarettes. And sir has said something. We are booking cases in section 4 and section 6, I guess. So. Loose cigarette is one of the major challenges now, because anybody just going and violating the public places through taking one butt of cigarette and 2 butt of cigarette, and because of this and these loose cigarette not banning and not enforcing efficiently, and it is happening passive smoking and secondhand smoking effectively. So to decrease this passive smoking and all, we have to more focus on I guess loose cigarette and working through police departments. Sir, my 2 questions, please, sir.
Yeah, Pramodji, Vivekji. So Pramodji has very valid questions. So let me answer his question. So actually, I am in constant discussion with Mr. Sanjay Seth of Sambandh Foundation. So I know that it is best to involve police department, but we can't ignore SLCC, DLCC, STCC, and DTCC roles. So definitely, I think MOHFW will be having a closed door meeting very soon, and there may be some amendments in the NTCP rules and regulations and the guidance also. So I think we can put up our views. So that is why we have undertaken these webinars, so that people learn about the enforcement activities in all the states. And I think each one of us in tobacco control, they are doing their bit on this issue. But then surely the Sambandh experience has been very good with the police department. And similarly, in some of the states, actually, health department is taking a lead, not the police department. But surely police has got an upper edge, and they can be very helpful in enforcement of the law. So, Vivekji, do you have to say anything about the issue? Pramodji, for the question
Yes, sir.
related.
Yes, sir.
Asked by
Pramodji,
the Pramodji. Hello.
Pramodji rightly said that police department is very efficient and very effectively managing Kumbh Mela and a very big crowd. So, Pramodji, actually, in Uttar Pradesh, as I know, in all the states across the nation, the police department for enforcement of the tobacco control laws is taking lead. For particular, if I say for electronic cigarette ban, only police department is notified as a enforcement agency. If in case the state had not notified any other. So we are doing actually in the state tobacco control cell and the district tobacco control cells are continuously organizing sensitization, particular for police department in the crime review meetings. They are participating, otherwise calling meetings with the department, and also they are the integral part of district tobacco control cell. Senior state level officers are part of member of state tobacco control cell, the state level coordination committee, district level coordination committee. They are coming and they are supporting in enforcement squad. They are part of these squads and taking lead in all the enforcement activities. They are doing this. In case of the loose cigarette, yes, this is very important to enforce and to stop selling loose cigarettes, and this can be very effective. And when the enforcement, in case there is a good enforcement, I shared in my presentation, I feel in Lucknow, the vendors displayed one plate writing mentioning that we are not selling loose cigarette. So these effects, and this is a very good actually strategy, and more or less we are doing in the state. They are doing whenever they are going for the enforcement. They are keeping in the mind, because in the presentation and sensitization workshops and capacity building workshops, the orders, the all DTCC state tobacco control cell members, officials, whether they are providing trainings, they are informing them that this has to be done. So yes, this is taken care of in Uttar Pradesh.
Vivekji, as I told you earlier, that legal metrology inspectors, they can play a very good role in implementing this loose cigarette notification. So do involve them. And I may tell Pramodji also, this legal metrology, under Legal Metrology Act. So
Yes, sir.
you
Yes,
can't
sir.
break a packet of anything, actually, any material, so that you can sell it in a loose form, because you need to have all 5 or 6 things under Legal Metrology Act on it, like the content, the date of manufacturing, the date of expiry, and the helpline number also has to be there. The toll-free number has to be there. So
Yes,
I
sir.
think that is a good tool with us, available with us.
Thank you, sir. Thank you, sir. Thank you,
So,
sir.
any more questions? So otherwise, we'll
Thanks.
just move on to vote of thanks, a formal vote of thanks, because it is already 1:25. So, any more questions? So, okay, thanks all, and we'll just move to a formal vote of thanks. So, over to Tamanna, please. Okay. Yeah.
So, good afternoon, everyone. So, as we come to the conclusion of this insightful session, it is my honor to extend a heartfelt vote of thanks to our esteemed guests,
Dr. Prakash Chandra Gupta and Mr. Vivek Awasthi for sharing their invaluable expertise and experiences with us today. Dr. P.C. Gupta, your contributions to public health, tobacco control have been truly inspiring. Your extensive research policy advocacy has provided us with deep insights. Mr. Vivek Awasthi, your dedication to community health and social development has been commendable. Your efforts in policy advocacy and strengthening healthcare systems continue to make a significant impact. Dr. Rakesh Gupta, President and Director of Public Health, Sipher, for his visionary leadership. I also want to thank Dr. Sanchita Gupta from Eco India and technical support for her technical support, and Mr. Rajiv Kumar, RCTC. And I also want to thank the experts, Mr. Sajuk Itti, Jail Thomas, Dr. Ramesh Gandhi, Casey Seni, and Dr. Dilip Kumar for joining and sharing their valuable views with us. A special thank you to all the participants and attendees. Your presence has made this session truly meaningful. Looking forward to continued learning and collaboration. Thank you.
So thank you all. Thank you. Thank you.